to my channel, Running with Dr. Andrew. This is Andrew. I'd like to talk to you about sacroiliac joint pain. Gotta run. See you later. Hi, welcome back. I'm Andrew with Running with Dr. Andrew. I'm a physical therapist. I'd like to share with you what sacroiliac joint pain is. SI joint is a joint that is on the back. It attaches to two bones. One's called the sacrum. It's a V-shaped bone that attaches to your pelvis, and which is your ilium. So that joint is located just on the side there. You've got two of them, and when you have pain, you can have pain directly on that joint there, or it can cause pain down your hip and down your hamstring area, and then sometimes even the groin area. Now, if your pain goes past your knee, most likely probably not SI joint pain. And typically, people will have pain with bearing weight on their leg, meaning putting pressure on that leg, climbing up and down stairs, activities like that. And how people injure this is if they, if they tend to cross their leg over, or if they're, fall or slip with their leg straight, they kind of jars that pain, that joint there. So you can have two problems with this sacroiliac joint pain. You can have one where it's stuck, and also one that is too loose. And there's a couple ways you can treat that, and we'll show you how to do that. And also you can have a stuck joint, and when it's unlocked, it is too loose. So if you're going to a chiropractor or a physical therapist and they keep unlocking it, and it has temporary relief, you most likely know you probably have some sort of instability, or the joint is too loose. And I'll show you a couple ways to help strengthen that area or maybe stabilize that area there. So I'd like to share with you 3 mobility exercises and 3 stability exercises. So the first 2 stability or mobility exercises, you're going to lay down. And first one you're going to do, you're going to use a stick or like a broom or something like that. And so if you have pain on one side, you can use this trick here. So you're going to lay down and then place the stick underneath your thigh. You can pick each one. You're going to do both of them, and so you're going to bring up, and then you're going to push down with one and up with the other. Kind of do a little bit of a counter force. Hold that for 5 seconds and then relax. Do that 5 times each for 5 seconds, and then you want to switch. So we're going to switch and go over to this leg here. Push and then pull. Hold for 5 seconds and relax. Hold for 5 seconds, relax, and do that 5 times. And that's why you make sure that when you do this, you want to rest your head down and like this right here. I'm just kind of coming up so that way you guys can hear me there. So that's number 1. The second one that you can do, kind of similar, and so what you're going to do is you're going to lay down again, and then keep that one leg straight. And then what you're going to do, kind of hold your thigh here, and you're going to push down. Hold it there for 5 seconds and relax, and bring your thigh in. Push, hold for 5 seconds, and bring it back in. And do that for about 5 times or so. And then also you're going to do the switch legs there. Push and hold. Push and hold there. 5 times for 5 seconds. You want to do these exercises throughout the day. And again, you want to make sure that they should feel good during and afterwards. So if they start bothering you, stop right away. And so the third stability exercise that you're going to do, or third mobility, is mobility exercise. You're going to use a stool. So we're going to come around here. And so what you're going to do, you're going to bring your knee up on the stool, and then you're going to reach forward and stretch. And again, it should feel good. All these exercises should kind of take some pressure off of your hip. And then relax. And hold it just for a few seconds there and relax. You can do this throughout the day again until that seems to start to improve mobility with those exercises. Let's go over some more stability exercises. Sometimes the SI joint can be more too loose, and so you need stability a little bit stronger around the pelvic area, around the lumbar area. And definitely that will help keep that pelvis nice and stable from moving too much there. And so I'm going to show you 3 different exercises that can help improve stability there. So the first one is that you can use a couple different things. You can use a yoga block or some sort of ball, or even a foam roller can help out, as well as maybe like a yoga strap or some sort of rope or something to go around your thighs there. So again, this is going to be kind of a pushing, pulling type of exercise, which with the mobility exercises, I did forget to mention that you may notice a little pop, and that's normal and that's okay. And so sometimes that can give you that relief that you need there. So then the same thing with this exercise. It's a stability exercise, but also you may notice a pop too, especially if that SI joint is locked up, and then that might kind of do a little popping there. And so what you're going to do, go ahead and lay down. And so first you can put your strap around your legs. Drop my block there. Place the strap around your legs, like so. Usually like to kind of cinch it up a little bit there. And place the block between the legs. Make sure that you lay flat back so that way you're not injuring your neck. And what you're going to do, you're going to squeeze the yoga block, hold for about 3 seconds, and then come out and push out and hold for 3 seconds. And this, again, this should feel good whenever you push and pull. If it doesn't, stop right away. And so you're going to push again, and then pull out there. That kind of helps get those pelvic muscles to start to activate better. Push, and so you're going to do this for about 20 repetitions there. So that's number 1. And again, you can use different materials, whatever you have at home. You just want something nice and stable. Sometimes using a band, elastic band, is too elastic for you to push out. And so you want something that will give you that resistance, that we call that isometric, where you're pushing against something but your joints are not moving there. So this is something kind of like this, a belt or some sort of strap, something to kind of give you that resistance there. So the second one is more of a core exercise here. And so if you've got a ball, a yoga ball or some sort of physio ball, as some people call this. So you're going to lay down, prop your legs up. I'm going to show you 2 different ways to do this, okay? If you can't do one way, you can do the other way. So this is going to show you the easier way, okay? So keep your core tight, and then what you're going to do, you're going to bring down your right foot and bring up your left arm, opposite leg, and come up. Keeping your core nice and tight, making sure that your arch your back is not arched up. That's going to cause back pain. So you want to make sure that back is nice and snug up against the mat there, okay, but not too much. So you can do about 20 repetitions of this, okay? Okay, that's one way to do that. So this is kind of more the challenging way. So if you start to get used to that and that feels okay, you can go on to the more challenging exercise here. Again, opposite arm, opposite leg. Come out and come back in. Come out and come back in. Come out and come back in. And do that about 20 repetitions there. That's going to help with stability with your SI joint, as well as maybe your low back. Now, if you still have some issues with stability, and you know you have a stability issue, you can get something called a SI lock belt. I believe this is a OPTP product. You can go to www.optp and get this ordered. And so this is a SI joint belt. And then how you put this on is that you can come over here so you guys can see. And so you want to make sure it's below your pelvis here when you put that on. And you can put this on underneath the clothing. It does have a little bit of a sticky type of material to go up against skin, but I'll show this over close so you can see how to put it on. So sometimes when you put this on, this can help out with pain. Strap it on. Again, you want to make sure it's your pelvis is kind of in this area here, so you make sure that it's below that pelvic area, and then you can strap this on. And then if you're walking and it seems to kind of help out your pain, you know that you probably have that stability, so you probably need some sort of SI joint belt with that. And so sometimes, you know, another way you can find out if this helps out, you can have somebody hold onto your pelvis while you're walking, and if that seems to kind of help out your pain, you know you may have an SI joint issue, and then you may need a belt. You can go ahead and order this belt. All right, that concludes our video of the SI joint pain. If you have any comments below, please comment. And if you haven't subscribed to this YouTube channel, please subscribe and ding the bell so you don't miss any other videos. And hope everyone keeps staying safe, keep running, and we'll see you next time.